Well, back with Dr. Nazari. Dr. Nazari, we talked about missing teeth and how a missing tooth can really create havoc in a mouth, even creating headaches, muscle tension, and of course the fact that one can lose many more teeth because of it. Tell me, what are some of the 1, 2, or 3 major ways these days on how we replace teeth? And, be brief in explaining each one just a little bit, just a big picture of it, the big pros and cons from the 1 or 2 or 3 replacement methods which exist currently.
Well, basically replacing teeth, we can divide into 2 broad categories. One of them would be the removable, which is the old and traditional way of replacing teeth, which is the patients can put them in and take them out depending on, after dinner or, after breakfast, after lunch, they can take them out, then, rinse them, clean them, put them back in. And then the new way of doing it these days are by the fixed dentures, which I mean by fixed dentures are that, they are attached to the neighboring teeth or they are attached to the bone under the gum. These are the new way of replacing teeth that the patient don't have to be worried about, taking the teeth out and put them back in the pocket or put them in a box and carrying them with them, which are very, very uncomfortable to the patients. The implants are the best way to go. They are usually just make it, very simple. There are screws that go inside through the gum into the bone, and then we replace the missing teeth on top of the screw. And then the second one is the bridge, which is again a fixed replacement. The bridges are connected to the neighboring teeth of that empty space that the patient already lost the teeth. And then the removable ones, depending on how many teeth they are missing, it can be anywhere from 1 to 2 or 3 teeth that they can replace the missing teeth. These are usually made of acrylic or plastic, or they can be made of some porcelain or china teeth. But these days we recommend going something fixed.
Right. So basically, perhaps a removable, a person would maybe put that in it for a short period of time. If for some reason he needs to be looking good for the weekend and things happened, he might want to put something like that in it and then come back and put something fixed in it, right?
Sure, definitely.
Right.
We do that all the time.
Yeah. Well, so let me ask you, doctor. Let's just say 1 tooth is missing, or for that much 2 teeth are missing. Give me the difference between a bridge, where you basically, you take 2 teeth, which are good still, and then in the middle in it, there's nothing, and maybe that middle is bigger and there's 2 teeth, and maybe there's only 1. You grind them down and you put a crown on it and you hang another tooth in between. I guess that's what you call a bridge, right?
Yes.
Right. So versus, let's say, taking 1 tooth, putting that metal rod in it, which I think is made out of titanium or something. Is that usually what it is made of?
Yeah. Are you talking about the implant or
yeah.
You're talking about the implants? Yeah.
I'm talking about the implant.
The implants are made of titanium, which are inert material, and then they have shown no allergic reaction and no rejection, throughout their short history. Well,
right.
Calling short in dentistry is about 30. In the past 30 to 40 years I've been using that, patients have not had much problem as far as, rejecting or having allergic to it. Titanium is an inert material.
Right.
We do that.
So a person gets, he gets 1 tooth fixed in the middle, replaces it with the titanium, metal sticking in it, and then the crown going on, or he gets it fixed by hanging one in between and using the other 2 teeth. Give me some of the major advantages / disadvantages of the 2, or when one is better than the other one. When would you recommend one versus the other one? Shed some light on that.
We can replace as many teeth as missing with titanium screws or implants. And then the only disadvantage would be the financial, because they are more expensive than the traditional fixed bridges. And also depending on when the patient decides to get the replacement. If the patient waits too long, unfortunately they lose much bone and they need to have additional surgery to add or augment the missing area with bone in order to receive the receive the titanium screws. Those are the only disadvantage of the implants or the screws.
Right.
As far as the bridge is financially is more affordable to the patients. The disadvantage is that we have to go ahead and trim the neighboring teeth and hang the missing tooth from the two neighboring teeth.
All right. Now, when you have to do that, you need to put a crown or a cap, as it's called, on those two teeth, plus the third one you hang. Wouldn't the price? I mean, is the price really hugely different, or is it just a little bit of difference if you, let's just say, have a 3-unit bridge versus a 1 implant?
Well, if you are talking about 1 unit, the price difference is not very much. But if you are talking about several missing teeth, then the price is a little bit higher.
I got it. Well, let me ask you this: in terms of longevity, what is your experience? You're doing implants for 30 years now. That means you also do crowns for 30 years because they've been around, bridges and stuff like that, because they've been around a little bit longer even. So what is your experience of how long a bridge lasts versus how long an implant lasts?
The implants can last for a very, very long time, depending on how the patient will take care of the implant. Proper oral hygiene, proper brushing, and flossing around the implant, and also seeing a dentist on regular maintenance visits, depending on what the dentist recommends to them, how often they come and get the cleaning done around the titanium, they can last a lifetime. And so are the bridges. That would last lifetime also. Again, it all goes back to how the patient take care of their teeth, the bridge, and then seeing their dentist, and also it depends to the dentist also that they properly install these appliances into the mouth. And if the patient selection is correct, they should last a lifetime.
Really? So both of them should last very long. So there's no major difference in how long they last, in your opinion?
No, they shouldn't be.
I see. But is it more difficult to maintain a bridge where obviously the teeth are together? There's no space in between anymore. Is that, in terms of flossing and maintaining them, a little more difficult and annoying to the patient rather than having the normal teeth which you can floss in between, brush in between, and so would it be on an implant? I guess it would be feeling and looking like a normal teeth.
Well, these days we have all kinds of mechanical tools that we give to the patients, and they're readily available at any pharmacy or Walmart. There are different type of floss threaders that help the patient to clean under the bridge or clean around the implants. And it just takes a little bit of skills on some patients, on the patient part, to properly maintain and clean their appliances in their mouth. As far as, it's not it's not difficult at all.
So you have not experienced that patients who have a bridge, due to laziness, due to slappiness, neglect those areas of the bridge, and by doing so they get gum disease in that area and more bone loss. You have not experienced that with your patients?
Well, unfortunately we experience it all the time. We experience it all the time that the patients don't properly maintain their appliances in their mouth. That's the problem, which has nothing to do with the material and with the dentistry and with the prostheses that we manufacture for the patient. These are the failure on the patient's part, that they don't properly follow the advice of their dentist.
Well, and I do totally understand that. So now, that being said, if a guy, or a girl for that much, I suppose, is a little bit on the slappy side and thinks that he's busy and is already taking the dental hygiene not quite as far as he or she could, the tendency to have a failure on the bridge because the gum disease starts could be slightly higher, not due to the fact of what the dentistry is, but due to the fact of that it opens the door for the patient to clean it less in that area versus an implant.
Yes, I agree with you 100%.
Okay. So that might be a reason why one might want to opt for an implant. If one knows one is a little bit on the lazy side on a certain area, one should go for something else. If one knows one is a little, take a mechanic. He knows he's getting dirty, so he barely wears white shirts to work, right? You see what I'm saying? I mean, that's maybe not a good example, but we do things where when we know, that we have a tendency towards something, we'll try to opt for the other product or service where that tendency is not handicapping us as much. All right. Well, Dr. Nazari, very informative. Thanks a lot.
Thank you, sir.